review a bit about the video slides, but also really what I'm going to focus on the most tonight is talking about motivational interviewing, which a lot of people are probably familiar with. So we'll kind of get into that and try to do some demonstration and practice, since motivational interviewing is really a communication style that undergirds a lot of the other aspects of the training that were in the video, like the brief intervention and helping people to set goals for their own alcohol use or even other health behaviors. So I'm going to try to breeze through some of this just so we can use our time most efficiently. And so I kind of said this already, we're going to review kind of some of the things we learned and then jump into motivational interviewing. So in terms of screening, some of the video and other slide set went through some validated screening tools. So things like the AUDIT-C, brief advice and brief interventions and approaches to take with that, as well as some basics of motivational interviewing that we'll dig into a little more tonight. And and then we'll have some time for question and answer and discussion. And I'm really hoping to still leave some time for that so everybody can get some answers to any questions they have. So just to jump in, so a lot of people have probably heard of motivational interviewing and maybe had some training in it, but just to go over briefly what some elements of it are. So motivational interviewing in itself is not an intervention, it's a communication style. So it's collaborative and goal-oriented and is a way of communicating with your patients or with other people that has certain features. So it pays particular attention to the language of change when people talk about wanting to change, intentions to make changes or thoughts about it. And it is designed to strengthen personal motivation or commitment to a specific goal by eliciting and exploring the person's own reasons for change. And a lot of this grew actually out of the rather confrontational traditional addiction, the styles of talking to people about addiction, which could be very denial busting and very confrontational and very moralistic at times and dogmatic. So motivational interviewing was really developed almost as a counter to that, as a way to demonstrate there's another way of communicating with people about addictive behavior that can also be effective and is less confrontational and sometimes shaming to people. Some people don't like that approach, many people in fact. So unlike that approach, is really delivered in an atmosphere of acceptance and compassion. And there are both technical skills in motivational interviewing. In the previous slide set with the video, I had some resources, and you can really learn a lot. We're just going to kind of scratch the surface of what it is tonight, and some of the technical skills you can find in other manuals and other trainings. But there's both technical skills, the sort of what, but then the spirit of MI is more the how. And the idea is that when done well, motivational interviewing involves listening more than telling. It does not operate from a deficiency model. The assumption really is that the person has knowledge and insight, and they are the ones who know themselves best. So you're really trying to bring out of a person ideas and solutions and motivation for change, as opposed to what the medical model often is that we're instilling information, teaching, telling, essentially directing people, while this kind of takes a different approach. You're more trying to draw it out of the patient or the client. And it's really built in this idea that people at their core have a desire and a capacity to grow and change in positive directions, and starts from that place. So instead of implying I would have what you need, MI communicates you have what you need. And so we're going to do a little bit of practice in the chat. So this is something that has worked pretty well in the past. So I'm going to teach some of these core MI skills. So we have the acronym for this is OARS. These are engaging skills to help engage people in a conversation about change. So in this case, if you're talking to folks about alcohol use, you could use these to engage a person in a conversation in a way that would make them more likely to want to open up and talk about this very stigmatized condition. And OR stands for O is open-ended questions, A is affirmations, R is reflections, and S is summaries. And OR is also, if you think they help move you through the water, so that's where that comes from. So just to start, open-ended questions are questions that can't be answered yes or no. They cast a broad net. They're useful for information gathering and allow for more detail and insight about a person and what's going on for them. Often beginning with how, what, or tell me about. So how do you cope with cravings when they arise is an example of an open-ended question. So we're just going to spend a moment, and if you could actually use the chat function, and I'm going to have everybody just try this. So you can just put any open-ended question that you could think of in response to this statement. So if a patient, this is very similar to a lot of the patients we see at our liver clinic. This person saying, I started drinking when I was in my 20s just as a social thing, but that changed in my 30s. After my mother died, it got really bad. I just couldn't get through the day without drinking. So if you can just shoot an open-ended question of how you might follow up with that statement in the chat, just to practice this. Yeah, so we've got some examples here. So how, if at all, does your alcohol use affect your life currently? That's awesome. So yeah, so that's a great example. Tell me about the impact that has made on your life. So these are really good examples. You can see how that type of follow-up question is going to elicit a lot of information, and the person could take it in a lot of different directions, as opposed to like, do you want to make a change? You know, was a closed-ended question, a yes or no, or anything that kind of boxes a person in. So, so yeah, those are great examples. So, all right, now, oh, I got my chat to stay on when I was doing this, so I shouldn't have to close it again. Okay, so, and then affirmations are statements that highlight an individual's strengths, effort, commitment, or attempts to change. And they build confidence in one's ability, as well as being genuine and congruent with what a person is communicating. So you're trying to affirm, give them confidence to say something complimentary, essentially, but specific to what the person is sharing, or some characteristic about them that would build up their confidence and their capacity to change. So examples of that are, I appreciate that you're willing to work with me today. You're clearly a very resourceful person. You handled yourself really well in that situation. Affirmations tend to try to go to like the character or the person, and things that don't count as affirmations in motivational interviewing are sort of generic praise, like great work or awesome. It has to be sort of tied to the person or something that they've done. So, so if you could think of an affirmation you might give back to a person who's just said this, you can throw it in the chat, just like we did the last one. So this person saying, then suddenly I'm in the hospital with some kind of bleed. It was so scary. I thought I was going to die. This doctor told me I had cirrhosis, and it was because of my drinking. I stopped drinking the day I got out of the hospital. I threw away every bottle in the house. So is there an affirmation someone could think of and that could follow up to say to a patient who's just told you this? And they can start with things like, you're a person who, it took a lot of courage. You have an amazing ability to do X. You clearly value, etc. So yeah, stopping drinking seems to be important to you. Not just anyone could do what you've done. Yeah, those are great. So things that you can imagine if you're saying this to someone, how they may feel after hearing that. They probably want to keep talking to you, which is a big part of motivational interviewing. And especially when we're talking about addictive behavior, where people tend to sometimes want to shut down or not share, doing affirmations during this can really help people open up, build their confidence, as well as keep them talking. So see some more good ones. You have a great ability to make good decisions to help yourself. These are awesome. That wasn't an affirmation. I said, those are awesome. These are really great suggestions. You're a great crowd. That's an affirmation. Got to make it more specific. So reflections. So the essence of a reflection is essentially that you are reflecting back to someone what they say. The essence is it makes a guess as to what the speaker means. And you want them, so statements rather than questions, they turn down at the end instead of turn up at the end. To make it a question, you want to make it a statement. And they can also be continuing the paragraph of what someone's saying, but not just reiterating. Ideally, they kind of make meaning or infer something with what the person is saying. So it's really an active process to reflect back information to people, but sometimes selectively, like reflecting back change talk, reflecting back positive statements. So examples of how reflections can sometimes start is, it sounds like you are feeling, it sounds like you're not happy with, so you're saying you're having trouble, I think you might be saying, and then you're essentially trying to reflect back what you understand from the person. So we can practice this too. So in this case, the reflection is, or the statement from the patient is, I thought I'd never drink again, but then over the holidays, I got into this huge fight with my boyfriend and someone called the cops on us because of the shouting. I was in such a bad place. So yeah, after that I drank. I just didn't care anymore. I'm not proud of it. So you guys can try throwing a reflection into the chat. So where you're reflecting back what you hear the person saying, as well as maybe the meaning behind it. They can start with things like, it sounds like you're feeling. Sometimes you can do double-sided reflections. On the one hand, it sounds like you're feeling this, and I also hear this. So here's some in the chat. So it sounds like problems with your relationship triggered you to drink more. So yeah, so that's great, because when you infer some meaning, the person will continue to talk and also correct you if you have it wrong, or either way it's good, because if it's not right, they'll correct you and give you more information. If it is right, then they'll continue like, yeah, exactly. They'll feel heard, and then they continue talking. So reflections are really helpful for moving a conversation, engaging with someone, and helping them feel heard. So there's also summaries. I might jump past this one so we can do a little bit of practice, but I want to introduce what they are. So summaries are sort of, so a reflection kind of reflects back what a person is saying. A summary takes a bigger look at everything they've said, for maybe you've been talking for a little while, then you summarize what somebody has said. So essentially reflections that pull together several different things that a person has told you. They can be affirming because they show that you're remembering and listening and trying to understand. And I really like this image that, I don't know if others have seen this, of therapy, where there's a therapist listening to a client, and then they're kind of taking the information and coiling it into organized balls of information, which is kind of like what a summary and also even reflections do. But what's special about MI is, I'm going to see if my little animation works here, is you don't reflect everything or summarize everything. You can be kind of selective with what you give back. So for example, change talk, any change talk, that's a big word in MI. Anytime someone's giving any information about intention to change, thinking about change, planning for change, you can really selectively reflect that and summarize that, because then the person will continue on that thread. So if someone gives you a bunch of information, sometimes the metaphor they use is picking the flowers of change talk, trying to hear the change talk, the positive statements, putting them in a bouquet and giving it back to the person. So it's reflections and summaries, summarize and reflect, but they also try to do it a little bit systematically to try to move the conversation in a direction towards change or towards considering change. whatever that goal is that the person's working towards, or that you're trying to help the person work towards. So so I'm actually going to skip this just for time, because we want to do just a brief demonstration of OARS, the open-ended questions, the affirmations, reflections, and summaries. And what I would like you to do is we're just going to do like a 5-minute OARS-based interview. And Dr. Mellinger is going to be the client or the patient, and I will be the therapist or the physician or the clinician. So what I want you to do while we're doing this is just listen for OARS and jot them down when you hear them. And then afterwards, we can talk about where you heard them or what you noticed, and do a little bit of debriefing about them and how they might fit into your practice. So I'll stop sharing just so we can try that. So I am going to, all right, so Dr. Mellinger. So so I'm gonna, sometimes you get screening or different information when someone's coming in. Jessica and I haven't practiced this, so I'm just gonna wing it, which is good because that's how it works in real clinical practice. So Jessica,
Yes.
it's so lovely to see you today.
Good to see you too.
So glad you came into the clinic, and I'm just wondering if there are any health concerns or things that you wanted to talk about today.
Yeah, well, I think basically since the pandemic, and I've been working from home all the time, a lot more than I used to, I'm not moving around or getting as much exercise as I was before. And so I kind of like some help with that and how to get more movement, more exercise kind of into my day. Because basically my Apple Watch thinks I'm dead. So
Yes. Okay, got it. Yeah. Sounds like you're really noticing that since the pandemic, your movement's really gone down and you're concerned about that and you want to do something.
Yeah, absolutely.
Okay.
Yeah, no, it's really declined a lot. And I think I just didn't realize how much I moved, more like walking into work or walking into clinic or going to meetings that were all face to face. And now I do everything by Zoom, and I work from home a lot. And so I just am not moving as much as I used to, and I'm not getting exercise.
Yeah. I'm noticing that you're really observant, and it sounds like you've been thinking about this quite a lot already before we even started talking about this. It sounds like this is something on your mind that you want to do something about.
Yeah, definitely. I've tried to think of some things that I can do. Partly I don't like exercise, so it's hard for me to want to do intentional exercise, like go to a gym. I don't love that, but I know I need to. So
okay, so I'm hearing that you want to bring movement and exercise into your life, and there are some things that you don't prefer. And so help me understand what you're thinking about.
sure. Yeah, I mean, I think that when I think about kind of two things, sort of just being more active in general in my day, and then also getting kind of intentional exercise, intentional strength training. I'm getting older, and so I kind of need to start, doing I've been reading about it, and need to start doing some of that intentional exercise. I always feel good when I'm done with it. 5 minutes into it, I'm happy that I'm doing it. I'm happy that I went to the gym. I'm happy that I'm doing it. But sometimes the inertia of my couch, the inertia of Netflix, it's like, oh, there's something really good on, and my couch is really comfortable, and there's an ice storm outside, and are all these various things that kind of keep me from wanting to do it.
Yeah, so yeah, present ice storm aside, yeah, I hear you. So yeah, I mean, you're quite thoughtful about what you like and don't like, and it seems like you kind of already have some ideas. And what I'm hearing is kind of two different threads. Like one is overall movement and activity in your general day-to-day, and the other is more intentional, like I'm exercising now, and that's and the inertia and the couch kind of come into play in trying to get into those modes.
Mm-hmm.
So yeah, what have you thought about in terms of like what you want to do or when you want to start, or have you already started?
Yeah, I mean, I've tried to kind of start, like I'm borrowing an office from a friend now at a building that's actually walking distance from my house where I live, so I can just walk in and work in the office and then walk home and get, get stuff that way. I think I struggle with like, should I exercise in the morning, or, should I exercise in the evening? And often when I save it to the evening, that procrastination and that like, "Oh, I don't want to do it, and I'm tired and it's the end of the day, kind of kicks in. And yeah, my mornings are busy, and so I kind of struggle with like, where do I put it? Where do I put it? And then I'm just like, "Ah, I just won't do it. I just won't do it at all, and we'll call it good."
Yeah,
So,
yeah, that's tricky. I mean, I commend you for already having some things you've set up, because you've already put enough thought into this to start taking some steps. And so getting some foundational things going, like walking into the office, is one thing you've got in place, and you're looking to commit to some other things, I'm hearing.
mhm. Yeah, it's like say walking is good, walking into the office and stuff. It's about a 15-minute walk each way. So, if I do that a couple times a day, or that's a lot. Still, it's pretty
Yeah.
good. I think like say I think I do want to do a little bit more than that, and kind of do, some intentional exercise to gain strength, and that kind of thing. Because in my 40s, I start losing strength. So it's time to try to keep it. But
Yeah, I'm hearing you want to do this, and you're just figuring out how essentially.
yeah, kind of like trial and error and trying like, well, I tried it here, or, maybe take my gym clothes to work, and then, over the lunch hour, go down to the gym on campus or something like that, and do it there.
Well, let me see if I can just summarize what I'm hearing, and then maybe we can talk about next steps, or putting together like a little bit of a plan.
Yeah,
How does that sound?
that'd be good. Yeah.
Okay, well, so I'm hearing that, one of the big concerns you're bringing today is around your movement, and really wanting to move more, noticing with the pandemic and as you're aging that it's becoming more important to intentionally put like day-to-day movement in, as well as some weight training and exercise. You've already taken some steps thinking about this, noticing the barriers that you're facing, like the comfy couch and the ice storm, but also the successes you've had, like the walking to the office and arranging to have a place to walk to. And but you want to put a little more in there, and maybe, yeah, make it feel like you kind of have a system, so you're not in couch land, like looking like, when should I do this? And should I do it now? It's so comfy here. So, yeah. If it's okay with you, it might be good for us to just put like a few ideas down, and then next time we meet, we could check in about them.
Yeah, no, that sounds great.
Okay, cool. So what are you thinking? I mean, like sometimes I like to kind of take like in the next week, or
Mhm.
what are things that you think you could do to make some changes? And they can even be small, they can be big or small, but I think the most important thing is actually that they be attainable. Like
Mhm.
something you're not just something you say, but something you're like, no, I think I could actually do that.
Yeah, I think I could do two things. Like I could make a plan to work at that office that I walk to, like on the days when I'm having research days and not clinic days. When I have clinic
Mhm.
days, I have to be done on campus. But if I were doing research days, that I actually get myself up and go to that office instead of trying to work from home, where I get kind of sucked into the couch and that kind of thing.
Yeah.
Um, and then I think the second one that I could probably do would be to just commit to like 3 sessions of intentional exercise. I'm not going to commit to how long yet.
Okay.
So I'm just going to
Okay.
say that I'm going to go to the gym for intentional exercise 3 times next week. I think
Okay.
that's reasonable.
Yeah. So you've got some ideas. Uh, how do you feel? How likely do you think it is that you'll do them?
I think it's highly likely. I think I feel very motivated to do, especially walking into the office. I did that this week and I really liked it. My office is the office that I normally use is very far away. It's at the hospital, but this one is much closer. And so that was actually really nice to be able to do and to see friends there too.
Yeah.
And then my husband likes to go to the gym, and so when we go, we often go together, and so that's very helpful to to get to the gym, and he's often motivating me when I don't want to go. So
Oh, that's
so I think it's highly likely that I should be able to meet those
awesome.
goals.
Yeah. And if you achieve those goals, how would you feel?
I'd feel really good. I'd feel like, okay, great, I can, I can do this, and kind of try to be consistent, try to keep just being consistent with, with meeting those goals, and not,
Awesome.
doing a lot for 1 week and then, not doing it, not doing
Yeah.
it.
Well, you've definitely got some insights and you know what you want. So it sounds like just carrying it out is the next step. So I think if we were in a session, we would kind of write this down. Make a plan, and then is it okay if I check in with you about this next week and see how it went?
Yeah, absolutely.
Okay, perfect. All right. And
And see.
so, yeah. Okay. So that is an illustration. Really, the MI skills that I was thinking about using and that I was focused on were really just the ors, and then but that's sort of the communication style. And then we have the topic, we have the goal. I'm getting the patient or Jessica's insight into what she wants and really helping her shape and build out, as opposed to really telling her what to do, but checking in to make sure that it fits with what she wants and kind of help scaffold that. So it would be great if people had wanted to share the ors that they noticed, any of those things. You are welcome to put them in the chat, or if you want to pop in on a video and share or unmute yourself. All options are on the table. So I'm seeing in the chat, so someone noticed an open-ended question wondering if there are any health concerns you wanted to talk about today. Also, help me understand what you're thinking about. An affirmation, you're quite thoughtful about what you like and don't like. And summaries, I'm hearing that. Yeah, very good. What did anyone else notice or have any questions about? So, and then there's, I like the summary. I hear that you want to exercise and that you don't prefer some types, and I'm interested in what types of exercise you do prefer. It sounds like you've already put a lot of thought into this, and then reflecting on what was said and summarized. So it wasn't verbatim for them. Yeah, that's important with reflections. So there's actually two types. There's a simple reflection, which is a little more verbatim, but still shows you're listening, while a more complex reflection, you change the words, you sometimes infer meaning. And someone's asking, how do you address the yeah, but barriers? Yes, that's a really good question. So motivational interviewing, so we're kind of focusing on ors, but motivational interviewing has a much bigger and broader orientation to it. And one of the big things that they emphasize is this idea of rolling with resistance. And so when you do get resistance, or folks, and this happens, I mean, Jessica was, pretty motivated. She's like right on the edge of ready to do this, and not everybody's in that place. So some of that you can avoid by letting the person really take the lead and try not to get ahead of them, which is tricky, especially when we're really worried about someone's health. But to the best you can, try to kind of figure out where they are, and this idea of meeting them where they are, getting a sense of where they're at, even, and that might mean they're not ready to change, but trying to explore that with the person. The other thing that you can do is, people who have addiction or who have a lot of health behaviors that they want to change are high on ambivalence. Motivational interviewing is big on ambivalence, and the ambivalence, the idea is that you have two strong emotions that are pulling you in opposite directions. So I really want to stop drinking and I really want to keep drinking, for example. So one thing that you can do when you get a lot of yeah buts is you can do something like a double-sided reflection, where you try to actually reflect back the two pieces to the person. So for an example from like what Jessica said is, on the one hand, and you try to end with the positive, but on the one hand, you really feel like you want to sit on the couch and it's hard to get up. And on the other hand, I'm really hearing you say that you're sick of feeling like a lump on the couch all the time. So how do we what do you make of that? And kind of put it back on the person, depending on what they've given you. So that's one strategy for helping resolve ambivalence. And there's another question. Are there any tips for what to say when people have a goal but are unable to come up with small, tangible things that will help them? Yeah, that's a great question. So if someone is really struggling with ideas, so motivational interviewing obviously is very like, you have the person come up with the idea. Sometimes people may not, or sometimes there's some skills that they just may not have. Like MI is a communication style. It is not the end all be all of helping someone change. So it's totally okay if you have an idea as a clinician of something that they could do and they really can't think of anything. You just to share it in an MI consistent way would be to ask for permission. For example, you could say, is it okay if I share a few things that have worked for other people that I've worked with? And then the person will likely say, yeah. And then you can share them and then get a sense of if the person wants to do that. So it's okay to share suggestions, especially if somebody doesn't have ideas. And also I think we've got just a few minutes left, but maybe if people have just general, oh, looks like another one's coming in. But if people have general questions too, you can feel free to pop them in there. And I think then we're going to wrap up in a minute. Okay, well, I want to make sure I leave enough time for everybody. I think there's another step to some of the things that programmatically that Dr. Tanner
but
done, so.
if you want to take this last question, that's totally fine too. Do you see it in there?
Yes, I do.
And there's a couple.
Oh, there it is. Yeah. How do you politely? Sorry, I did not see that one. Thank you.
And one before that too. If you want to, that's totally fine. And then we'll wrap up.
So how to politely interrupt when someone who has taken an open-ended question who has gone on a tangent. Yes, this is so. MI is interesting because the idea is you're really trying to get someone talking. And some people don't need a lot of encouragement. So you can, like, you don't have to do tons of reflections. If someone just doesn't need a lot of prodding to just share a lot of information with you, you don't have to do tons of open-ended questions and continue to reflect if it's just time to shut it down. You've got a patient waiting in the waiting room or 10 waiting, and you just need to get through this. I interrupt patients. You can do that. Sometimes you have to. And you can just say, oh, you know what? Like you just do it politely, essentially, and say, let me just stop you right there. I have a thought that I'd like to share with you, or let me stop you right there so that I make sure we have time to put together some ideas about things you can do when you leave. And sometimes you even say it apologetically, like, I really want to hear what you have to say, and I apologize, like, I just want to make sure I share this last thing with you. I mean, that's always tricky. That's kind of the art part, is kind of figuring out your ways to phrase those things, but it is okay to do that. We're in a reality of short appointments sometimes. So yeah, great. Well, thanks everybody.
Sorry, I have a question.
Yeah.
Okay, so your patient is all ready and doing some action. So the biggest problem I have is patients who are pre-contemplative. I mean, the spouse said he's drinking, and when I ask him, and the spouse said, don't mention that I tell on him. Okay?
Oh, okay.
So now that I sort of try to confront the patient about drinking, but he said, I'm not drinking, just maybe one drink sometimes once a week. But clearly he's lying, so he's not really ready to take any action at all. So how do I motivate him to push him into the further into the stage of change?
Yeah, that's kind of a special and tricky situation, because you've got information from the spouse, but they have told you not to share it with the
That's
person.
right. Yeah.
So you yeah, I mean, if it's possible, it's better if the spouse will give you permission to share it or talk to them about themselves. I almost think of like almost taking one step back, like to see if the spouse would be willing to come into to the appointment with the person. So then in the room, they could say something so that you've got, because it's like rock climbing, like you need something to be able to grab hold of.
No, there are cases when the spouse say yes. I say, if you won't let me tell him that I know you're drinking, if you're not willing to come in, so it's very hard for me to break this, to bring this topic, because he would just say he's not drinking. I know he's drinking. The spouse say he's drinking. So I know sometimes the spouse say, yeah, okay, because otherwise, if I let him know that, then their marriage is going to get into more trouble, right?
Right. Yeah. Yeah. I'm just trying to think of what I would do in that situation. So, I mean, you can certainly ask, and you can certainly give feedback and information about alcohol use. I mean, potentially if you give like they have validated screening, like the AUDIT-C, if you do that when the person's coming in, sometimes they might be more willing to report something on paper or to an MA as opposed to the doctor. We find that in our clinic, sometimes people will tell the nurses a lot and then they won't mention it to the doctor. So if there's maybe another way you could get the information where you could have it, is one thought. The other is to try asking those questions. And then if you want to couch the discussion in something more universal, like, hey, there's something I've been talking about with all my male patients over the age of 50. Like, this is just something we're seeing a lot of in the clinic. And try to maybe like see if you can wiggle your way in to start talking about it as something that you're talking about with everyone because it's been coming up so much in your practice, that it might open the door a little bit. And the person might mention like, oh yeah, sometimes that happens for me. Could be maybe like a sideways way to get to it. The other thing is, even if someone doesn't share their personal information, you can always give resources. So it might be something that you say, like, we're giving these out to folks, and make it kind of a bit more of a generic, like, this is information we're handing out today. It's Alcohol Awareness Month, or whatever it is, and try to just get a little bit of information in there if you can't get the person to really share. But I don't know if Dr. Winder or Mellinger, who are also excellent clinicians, if you guys have any thoughts, because at Liver Clinic we certainly encounter this.
I think the only thing I would say is that, when you have kind of conflicting information, you can really trigger people to just become more defensive. Human psychology and their studies to back this up, that confrontation to people who are not ready to change actually digs them in. And so emphasizing things like, it sounds like your spouse is really concerned about you, normalizing. It's really common to get a lot of different perspectives, normalizing by saying people are on their own journey, we may not be there yet. And then really investing in the alliance, saying things like, hey, it's common to be confused and unsure about what's happening. I find myself in this situation all the time in this clinic, but I want you to know I'm here to understand, what's going on with you, whatever the case may be, whether you're drinking or not. We're committed to helping you regardless. Those things sound really simple, but to people who are in the meat grinder of addiction, the kindness and the openness, and when they feel you pull back from confrontation and accusation, you can really build strong relationships. It sounds trite when we talk in kind of a vacuum like this, but when put into practice with people who are really struggling and suffering, that kind of just neutrality and acknowledging, like Dr. Fernandez is saying, the different parts of what's happening, can be surprisingly potent to get people not only to come back, but maybe when the spouse isn't around, to open up and say what's really going on.
That's fantastic. And apologies again that we started a bit late, but perhaps we will wrap up if that's okay. I just wanted to end with a huge thanks to the Michigan group. And again, we will be sending out the recording, but if you could change, especially the Anns in the room, if you could change your name to just by using the function by clicking on the 3 dots on the right hand corner of the square with your name, as I've got there. If it's possible, there is consistent with kind of, am I thinking about ways that you can make changes to your practice, small changes, and what steps you might take to start to implement this change. So I'd ask you to take 3 minutes, and you can do this afterwards, but is there any other instruction for how to change the name? It doesn't seem to be working for some people. Let me see. I just went to rename. I just clicked on the little more underneath my name and then the arrow, and then it said rename. Maybe try that. So if you could try that, Deb and others, and see if that works. Sorry, so with this, if you can think about answering these questions, and again, just given the time, you can certainly do that afterwards, and you can scan the QR code that you see on the slide or click on the link. They'll also be posted in the chat that Nandini will do here. And once you've completed the form, you can download a copy of your responses, and then we'll send you an email in 4 weeks as a follow-up email to see how you made out with your changes. And I just want to also take a moment to introduce another program that the Royal College and the Canadian Family Practitioner group has come up with called My Lifelong Learning Plan. It's a free online tool that promotes self-reflection to identify areas to advance your practice. And you can earn up to 24 Main Pro certified credits with this. So this is another tool that you can use. And last slide, we would really appreciate your feedback. Again, apologies for the challenges with the link tonight. This was a fantastic session. You'll all agree with that. Really good learnings. I always learn when I hear Anne speak, or any of the 3 from Michigan, actually. So if you could please take a moment to fill out the evaluation form by just scanning that QR code, that would be really appreciated as well. And please do come back next week, because we'll have Scott presenting on pharmacological therapies and really taking this a little bit further. So thank you everybody for attending. Thank you, Anne. Thank you, Scott. Thank you, Jessica, for coming.